came to Legacy for the people. Residency is hard no matter where you go, and you want to find a place that has people that support you, that are professional, and that can work together through hard times. Here at Legacy, we really value wellness, and we have retreats quarterly to get together to talk about how things are going, to share stories, but also show support for each other.
At Legacy, we care for a diverse and often underserved patient population. The opioid pandemic has touched all corners of our country, and combating this crisis is one of my specific areas of interest. All residents complete dedicated training in medication-assisted treatment, including inducing and maintaining patients on medications like Suboxone and buprenorphine. As part of the Opioid Use Disorder Quality Improvement Project, we are working on building tools for providers to help perform inpatient, outpatient, and at-home inductions. We're also working on building robust education tools that can be given to patients when they're undergoing the induction process. Our clinics are patient-centered medical homes that offer wraparound services for patients, including pharmacy, social workers, case managers, and behavioral health providers who all collaborate to care for this vulnerable population.
Point-of-care ultrasound is the way of the future and only gaining momentum in the hospital setting. Legacy places a huge emphasis on training residents to be proficient operators of ultrasound. We have designed a wraparound curriculum to train up and maintain ultrasound use. The butterfly pocket ultrasounds are available for every wards team at both hospitals and in both clinics. These plug into your phone and allow you to ultrasound on the fly.
The ICU training here at Legacy is second to none and allows for residents to provide care along the full spectrum of disease severity. Medicine residents are unopposed in the ICU, which allows for an abundance of opportunities with procedures and managing complex patients. We get exposure to both cardiovascular and neurotrauma cases, and there's even the option to pursue an ECMO elective for those who are interested in taking their training to the next level.
I personally came to Legacy because of my experiences here, both as a third-year medical student and in my sub-I. All the team members here are approachable and treat each other with respect.
What I like working at Legacy is really the people, the environment that is created for a really supportive learning, as well as a really fun learning environment, is what makes the experience worthwhile. My co-residents are really awesome. I love working with all the attendings, whether they're in the ICU or on the wards or in the clinic, as well as the staff. Like, everyone's familiar with who residents are and what residents are there for, so it just really makes for an awesome learning environment. I'm actually from Hawaii, from the island of Oahu. The environment between the two places, it's very similar. Obviously, I come from a place that's quite melting pot, and I feel that Portland can be a similar place as well. And the camaraderie between people is very similar. It's an environment where you can be accepted by many different people, or a lot of ideologies are accepted as well. So it's a kind of a nice place to be in to train and learn to become a doctor.
Hi guys, my name is Amin, and I am a Legacy graduate from 2013. And I stuck on afterwards because I was driven to work in a clinic setting, and I was really attracted to the philanthropy of our program and our residency clinic. And I stayed on to work with the residents, and we take care of an underserved population that's really an at-risk group, and they're disenfranchised and medically complicated. It's difficult work, it's rewarding work, and intellectually it's very satisfying, and I really just love working in this setting with the residents as we kind of come together and all learn together. And that's really been truly one of the best parts of my job, is getting to work in this environment. And these people who were once my attendings are now my peers. And so I really enjoyed getting to be in this community of really great people.
I moved to Portland from Florida and really didn't know what to expect. I fell in love with all the scenery. I'm just starting as an attending at the Downtown Residency Teaching Hospital. This place grabs you, both the residency program and Portland. There's something about the combination of academic teaching and encouraging atmosphere that makes you want to stay.
Teaching in the ICU is very dynamic. We have bedside teaching, where we're teaching in procedures and we're teaching in exam skills that you can use in all aspects of medicine. And then we're also teaching you very individual patient plans and why we are choosing to do those plans for those patients. And then after rounds, we have teaching on fundamental critical care topics, including ARDS, post-cardiac arrest care, stroke, ICHs, subarachnoid hemorrhages. And then we also have mock code blues as well, so you can practice your skills in a controlled setting. I returned to Legacy after my fellowship because once you're a Legacy resident, you're part of a Legacy family. And I wanted to take care of the patients of Portland, but I also wanted to be able to give forward and be a mentor like I had the mentorship when I was a resident.